Hey, Dr. John here. We're doing our first Facebook Live video. Let's see how it works. So basically, I wanted to put together a little bit of a coronavirus update for you guys. As you know, I'm sure you're probably tired of hearing about it, but the dust settled a little bit, so I kind of put together a few things you probably haven't heard and just wanted to discuss those with you. So first off, what is the coronavirus? Well, there have been coronaviruses around for a long time. I've seen them on virus panels, and this has been going on for quite a while. Basically, every few years, a bad strain of it comes around. A little ways back, you might have remembered the SARS virus. This is a similar virus to that one. What ended up happening that made things kind of go out of hand is a lot of people caught this virus at once, and it kind of popped up in other regions as well. So just wanted to kind of go over what it is, some things you can do about it, why it's dangerous, and what kind of things you expect with it. So this coronavirus this time around is called the Covid19. That stands for Coronavirus Disease 2019. It's also called SARS-2. SARS, as you remember, going back a little ways, wiped out a lot of people, and it was kind of scary. So a lot of times the media and everyone comes around with these crazy viruses, and I think this is going to be coming around a lot more, especially after this one when they found the impact. If you guys remember way back when swine flu was out, we had a project, and we kind of, this was for undergrad, we had to actually analyze the numbers and see if it was actually a big deal or not. And it actually kind of seemed like it wasn't. So I was very hesitant to make a big statement about this to our patients. I kind of said, just take it easy, protect yourself, wash your hands, stay away from sick people, the usual stuff, and you should be covered. All right, so this coronavirus, it kind of popped up in this China region called Wuhan. And in 2019, there was 80,000 confirmed cases in that area. And basically kind of went from there. One thing to keep in mind, so they said 80,000 people have the disease. A lot of people are never going to get tested. They're going to just have mild symptoms. So who knows how many people actually caught this. There could be 1 million people with it. There could be 10 million people with it. We don't really know. But the last numbers, there's about 80,000 people confirmed with it in 2019. So originally, they tracked back the original source of infection to a seafood market. Coronaviruses are well known to go between humans, bats. So the seafood market, there was a lot of live animals being sold along with seafood. A lot of people enter contact with each other. We know that coronavirus, you basically can have the virus for 5 days to like 2 weeks before you even have symptoms. So I'm guessing someone or some animal had this and passed it to a bunch of people. They kind of passed it to all their near contacts and so on, and everyone got sick at once. So we said the live animals that you got to be careful about, seafood, they know that bats, rabbits, snakes were sold at this area along with other things. So what's interesting about the coronavirus? Basically, you get flu-like symptoms, and this is the weird thing. You actually get a viral pneumonia. So a lot of times when we get pneumonias, it's bacterial in nature. A lot of times you'll get something that injures the lungs or the airways, and then bacteria kind of sets up shop and does its thing. This is a viral pneumonia. So basically people get fever, chills, they might get stuffy nose, and it'll go straight to lower respiratory symptoms. These are coughing, wheezing, things like that. So one thing that they've noted, a lot of times we have this one test. It's not frequently used that I see, but sometimes when you're trying to figure out more complicated cases, use a Procalcitonin test, and that's pretty sensitive to bacterial infections. In these coronavirus cases, people will have a pneumonia, but their procalcitonin will be low. So that kind of means that something's irritating the lungs, but it's not a bacteria. In this case, it's the virus. Basically, treatment is supportive care. What does that mean? That means if someone's doing fine, you just keep an eye on them. If they're doing bad, they might need respiratory support, whether it be just medications that open up the airways or oxygen or ventilators, things like that in the more severe cases. So basically, one thing that you need to keep in mind about coronavirus, it seems like steroids are bad in these cases. Unless there's a very good reason to use the steroids, you kind of want to avoid them. This is extrapolated from other coronaviruses, but they've seen worse outcomes using steroids. That's more for my other healthcare providers out there to keep a note on, but just want to pass that one on. There are a few medications out there that they're still kind of researched, but they've had some success against these coronavirus. One of them, and let me look down, is remdesivir. I don't really know too much about that one or the brand name, but it's kind of got some experimental stuff. There's also some HIV drugs, I think lopinavir, ritonavir. It's a combination of two things. I guess it shuts down some of the replication pathways that the coronavirus uses, and that kind of slows this virus down as well. With how big this was, I'm sure all the pharmaceutical companies are going to be looking for vaccines and other medications that will work against it. Obviously, the ways to protect yourself. The World Health Organization said that they didn't really need to actually ban travel and things like that. They said be careful, don't go to regions like China, Iran, Italy. There's a few other ones, I think South Korea, unless you have really good reason to do so. It seems like a lot of people are doing these respiratory masks with toilet paper and things like that. I'm not sure that's going to be helpful. Make sure you wash your hands. I went to buy some Purell for our office, and I realized Amazon was all sold out. I couldn't piece it together until like a couple days later. It was all over the news. Make sure you use good hand hygiene, but you should be doing this all the time anyways. Trying to think what else. Lysol's known, if you look on the back of the Lysol cans, they actually can, it's listed on there that they can take out coronaviruses. Those are kind of the big things. I'm trying to think, you guys got any questions or anything? I just wanted to kind of fill you in. So just be careful. I think it's a little overblown. Just know that it makes viral symptoms with lower respiratory things like a pneumonia. Steroids are bad to use in these things. When I say steroids, I mean corticosteroids like cortisone, prednisone. So be careful. There are probably some cases where they are useful, but just keep an eye out. I feel like after how big this was, there's going to be like a virus every week or month that the media is going to capitalize on. So hopefully that's not the case, but just be careful and you should be good. Thanks, guys. Anyone got any questions? All right. Have a great one.